Hi, I'm Sarah, the Real Simple Mama, and this is Tiny. Hi. And we're going to show you what we do when she is cramped or bloated or she needs to pass gas. I know. Now, if your baby is being really fussy and you think that they need to pass gas or maybe that they need to do a poop, then you can do this technique. I like to try to do manual things like this to help her out instead of just giving her gas drops. And she's now 3.5 months old, and she has a decent amount of fussiness due to gas. She's breastfed, but I've only had to give her gas drops twice, and I do this technique with her. Honestly, we do it pretty much every day now, don't we? Yes, we do every day. Now, keep in mind if your baby has just eaten and they're being fussy, that their tummy is right here. Here's her sternum. It's hard, 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 and firm. As soon as you get to the soft point, this is her tummy right here. And if they've just eaten a lot, you may not want to do this technique yet, just because you're going to be compressing this part of her torso a little bit. So you can try burping first. And the other thing that you can do is you can feel, look at this cute little tummy. You can feel on their tummy if they're acting fussy and this feels really firm, then that's a good sign that they've got some gas and they need some help moving everything. So what I usually do is I lay her on a hard flat surface. This is our changing table. And I'm going to keep one hand on her shoulder right here, not holding her or grabbing her, just relaxed right here to keep her from sliding this way. And then very relaxed, I'm going to just gently put my fingers around her 2 feet together. No, I have really tiny hands, so this will probably be easier for you than it is for me. Nothing that I'm doing is going to be forceful or against her will. Now, she's used to me doing this, so as soon as she feels me grab her feet, she relaxes her knees. She unlocks here so that her knees are soft. But if your baby is forcing against you and kicking and locking their legs, then you can just tickle behind their knees, and that will make them relax their legs so that you can do this. Now, what you're trying to do is get whatever is bloated or stuck here, try to get her to pass it. So I'm going to hold right here, and then I take her legs and I just bicycle them like this. And you're wanting to bring her knees up, and you can get her hips and her bottom completely off of the table. Babies are super, super flexible. So as long as they're not fighting you, you don't have to worry about hurting them. Does that feel better? Mm-hmm. And for some reason, when I started doing bicycle legs with my first child, with my son, I started doing it so essentially I look like I'm pedaling backwards. But you can, of course, do it either way. So now I'm going to switch. There. There. And she's completely relaxed. She's to the point now, since we do this so regularly, that now she just completely relaxes when I lay her down and I grab her feet because she knows what we're going to do. You can also just pump back and forth, or you can hold. There. And within just a minute or two, they should relax, they should stop fussing, and hopefully they should pass something. You can also, if you're not worried about them sliding upwards, you can grab each foot individually. Again, you're not holding tightly, it's very relaxed, nothing against their will. And cycle them individually like this. And you can go way, 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 way up. Remember, when they're in the womb, they're like this. So she's really flexible. There. Now we can show off our diaper cover. You can go the other way. You can rock. Now, if you feel like they need to pass something, but for whatever reason they're having difficulty, there's something you can get at any type of pharmacy store like CVS, Walgreens, maybe your Walmart or your grocery store would have them. They're called glycerin suppositories. And of course, a suppository is something that is inserted rectally, but these are specifically for babies, and they feel very, very soft, like they're made out of wax, but you don't insert them all the way. And essentially what you have to do sometimes with newborns is teach them to poop or teach them to pass gas, because they don't have to do those things in the womb. That's completely new after they're born. And essentially all you do is, if I was laying her like this, I would hold her feet up and take her diaper off, and I would have the glycerin suppository, and you would barely insert it, just less than half an inch, just so that it's barely in the rectum, and just gently twist it. This sounds kind of crazy, but you're basically like tickling or stimulating their rectum so that they get a sensation down there, and that teaches them or reminds them, oh yeah, hey, that's how I do it. and then that helps them pass gas or poop if they need to. Just be prepared with an extra pre-fold or a cloth or something down here like I've got, because you will be rewarded, if you know what I mean. Yeah, you know what I mean. You can also, if you want to try this at home and you don't really want to go buy glycerin suppositories just for that, you can use a rectal thermometer. This is the Vicks rectal thermometer. I love this one. I have like 3 in my home. And you're only going to want to insert the max this. Again, it's not about inserting anything internally. It's just about stimulating them down there. And you can just barely insert it and then just rotate it a little bit. And then if they're being fussy or they're a newborn and they haven't pooped in a few days and you're worried about it, you feel like they're bloated, you can try that. I know. It definitely will not hurt them. Just make sure your thermometer is clean, or you only use the suppository once and you throw it away. But you have all of those different techniques that you can use if you are just not wanting to give your child gas drops.